So you've started hormone therapy, you're wearing the patch, you're doing everything right, but your hot flashes, mood swings, and brain fog just won't quit. So what gives? Today I'm breaking down why some women don't respond to standard doses of estrogen and how to fix it so you can finally feel like yourself again. So, first, we have to understand that the goal of hormone replacement therapy is not to restore youthful hormone levels, but actually just to relieve symptoms. And so often when we're dosing hormone replacement therapy, we need much lower doses than we would have needed in somebody when we're giving birth control, when we're suppressing the ovulation. We know that the symptoms linked to low estrogen that happen in perimenopause and menopause include hot flashes, mood swings and mood changes, sleep issues, brain fog, and vaginal dryness. Now, when we are monitoring people for being on hormone replacement therapy and adjusting the dose, we are not using labs to dictate this. In fact, research shows that it's not really an effective tool to do someone's blood work and then say, okay, based on this blood work, you're at a good dose, or based on this blood work, you need a higher dose. We often go by symptoms because every individual is different for how they respond to hormone replacement therapy. And so when we go by symptoms, we know that the dose that is the most effective at managing those symptoms is the dose that is best for that individual. However, when we look at research, we do know that there is what's known as a therapeutic threshold. Okay. This means that most women who are surveyed need a serum level, so a blood level of estrogen around 200 pmols per liter in order to get significant relief from their hormone replacement therapy. Now, again, this doesn't mean that if you are not at that level that you need a higher dose if your symptoms are adequately managed. But what this does mean is that there's research showing that 25% of women on the highest standard dose, so when we go up the dose, there are standardized dosage ranges. So, for example, with the Estradot patch, we go 25, 37.5, 50, and 100. And so 25% of women on that highest dose, that 100, if we're using Estradot as the example, don't actually reach target levels and they actually don't have symptom relief. And so some people will have symptoms persist despite this higher than normal dosing. Now, there's a lot of factors that impact the ability of the hormone to absorb, including skin thickness, age, whether you're using a patch versus gel, and lifestyle factors. We know that smoking interferes with the ability to absorb hormones. We know BMI also interferes with the ability to absorb hormones as well. So, what this means is we could have two women with the same patch and very different absorption levels. And so each woman is going to have a personal symptom threshold. So we see that different individuals are going to feel that symptom relief at different thresholds. Some women need a higher level to feel well, and some women actually feel really well with a lower level. And so when we see somebody who doesn't get symptom relief from seemingly a higher dose of estrogen, we want to make sure that we are fixing a few different things. So if you're on the patch, for example, it might not be delivering enough hormone into the bloodstream. So, some practical fixes: number one, making sure to apply the patch to clean, dry skin, a firm application so that it sticks evenly, and rotate sites each time you put that patch on. Number two is try a site with better blood flow. So, if you're using one area, we might use a different area that we feel like gets more circulation more consistently. Again, if patches are under delivering for you, you could trial a gel because for some people that does have a better absorption rate. If symptoms persist 3 to 4 weeks when you've been on a stable routine, then testing levels might be an option to determine whether or not a higher dose is needed. Now, I just want to reiterate, if somebody is on a low dose, I don't test levels before I will increase their dose. But if somebody's on the highest available dose and they're still not getting enough relief, this is when we start to dive in a little bit deeper, right? Now, again, personal thresholds vary and your relief might just need a higher number. There are also non hormonal drivers that exist: sleep apnea, anxiety, iron deficiency, thyroid issues, insulin resistance, and poor sleep hygiene can overpower any patch. And so, again, if you're not feeling better on hormone replacement therapy, it is not just the hormone replacement therapy that is intended to fix everything. We need to make sure that we're looking at the whole picture. We're looking at other blood work. We're treating for other imbalances, nutrient deficiencies, and everything else. And also, timing matters when we do. When we do hormone therapy in women who are in the earlier stages of that perimenopause shift, typically they will respond better for the mood and sleep impacts that hormone replacement therapy can have versus in the later stages of that transition don't tend to have as good or robust as of a reaction or a benefit. And again, local symptoms need local treatment. So if you're on a systemic estrogen and you're still experiencing vaginal dryness, pain with intercourse, yeast infections, and UTIs, vaginal estrogen can be a really good move rather than continuing to increase those systemic doses of the patch or the gel. And then also having a stepwise game plan is important. So to recap, number one, optimize the application and routine. Number two, switch sites and potentially format to a gel if you feel like the patch is not enough. Step three is rechecking those symptoms after about 3 to 4 weeks of consistency. And if you're still struggling, it might be helpful to test your estrogen. If your estrogen is below that 200 threshold, it might be time for you to discuss with your practitioner that we need to titrate up, right? The other things that we need to treat are blood sugar balance, sleep hygiene, and nervous system regulation. Now, being a non responder does not mean that hormones can't help you. It just means your plan needs a little bit of tailoring, personal delivery, verifying levels, and treating what estrogen cannot. Like and subscribe for more women's health education. And if you want a personalized roadmap, book a consult in the link below.